Dr. Vinod ARORA is going to speak on, he's a chief and presenting author, comparing outcomes of transepithelial surface ablation to femtolasic for high myopia surgery. All yours, sir.
Thank you. Good morning. So my topic is today comparing outcomes of transepithelial surface ablation to femtosecond lasing for high myopia surgery. The purpose of study is to compare the one-year outcomes of transepithelial surface ablation with femtosecond laser for high myopia surgery. In this retrospective study, data was collected from 256 eyes of 135 patients. The two study groups were matched by age, gender, and baseline undercorrected visual acuity and refractive astigmatism. The instrument used are the wavelight allegretto laser and IFS-150 were used for femtosecond laser, and streamlight from wavelight was used for transepithelial surface ablation. The number of cases were 256, out of which 150 were femtosecond lasing and 98 were transepithelial surface ablation cases. The femtosecond, the amount we taken for myopia was 6 to 10 diopter in both the cubes, and the maximum cylindrical amount was 4 diopter. So the total spherical correction was not more than 10 diopter in these cases. So best corrected acuity we achieved in femtosecond lasik in 3 days, while in advanced surface ablation it was on 10 days. Major complications were practically nil in both the studies. Minor complications were there which were resolved itself. These are almost matching. Then post-operative visual acuity in 156 patients, we were able to achieve better than equal or better than BCVA's 148, that's 95%. In advanced surface ablation, it was 98%. So the corneal refractive surgery includes microcotome surgery, femtolasic surgery, SMILE, and advanced surface ablation. PRK1 almost got abbreviation, has come back to as advanced surface ablation. The game changers are mitomycin, the newer wavefront optimized epithelial removal system like SmartSurf or Streamlight. The study demonstrated that ASA has a good outcome for high myopia. Its range is as good as of that LASIK or SMILE, being more tissue preserving and better biomechanical safety. Advanced surface is gaining popularity. Our result shows that one-year result with both the techniques are comparable. However, the transepithelial advanced surface results are marginally better than femtosecond laser. The surface ablation is one of the most effective tools in the surgical armamentarium of the refractive surgeon. It is still underutilized, but is a very promising and exciting with superior results. Thank you. These are my references.
Very well said, sir. Little restriction on the powers we can cover up in transepithelial, but otherwise it's one of the very promising.
Yeah, see, the Alcon has recommended up to 10 diopter spherical correction. Of course, for over 8, we prefer ICL, but some of the patients which are not fit for ICL or doesn't want to pay much that much amount, then they go for LASIK also. Some patients don't prefer lens surgery, maybe for some reason.
So do you do the epithelial marking and mapping in all the
Yes.
cases, and do you take that into
That's
consideration?
important, you to know the epithelial mappings.
Your results have been very promising.
There's the flip side, you need a OCT which can measure epithelium, and second, there is a per procedure fee in this also.
How do you rate it with PTK and PRK versus a transepithelial?
Basically, the pattern of removing epithelium is totally different. If you do PTK, there is a myopic thing is there. While in this is an optimized removal of the epithelium, so it's a neutral removal of the epithelium as such. So you don't got anything. And second, being very smooth, it makes the healing very, very quick and very smooth that way. So it's much superior to what we call a transepithelial, PRK such we call it. It's much, much better than. The basic thing is here, the removal epithelium is different. It's a wavefront optimized in this one.
Correct.
While this is a planar one in other PRK.
Correct, sir.
Any complications or any surprises you saw in your series?
Practically there were no complication as such. Of course, there was recovery slow. There is a more pain that compared to LASIK, but that's been explained to the patients. And we make sure the patient avoids UV lights. He has to use UV goggles that we provide himself, not from the market, and that has to be used for 3 months. And if he's going to high hills or is going to beach, then again is to use these glasses.
And how long did it take for the epithelium to heal in your series? You said slow healing.
Normally on we see on the third day it's totally covered.
Okay. Thank you, sir.